So we have a center for rare eye diseases at LV Prasad Eye Institute. We've sort of formally inaugurated 10 years ago, soft launched. And I know Ramaya Garu for the last 10 years. So through this presentation, I want to give a tribute to him. I think having known him for a decade, on behalf of all of us, I want to thank him for not only inspiring us and also with unwavering dedication. He doesn't have to come every year from sit and be there every time. It's not a symbolic gesture. He's been so passion driven, committed, and every year I've seen with the renewed enthusiasm. We want to do bigger and bigger, and so I wish him all the success. And he has been one of the guiding force, at least for me, to establish a center for rare eye diseases at LV Prasad Eye Institute. 4 megas cities in India like Delhi, Mumbai, Chennai and Calcutta. So that big is a problem. So it's very, very important to recognize them, and nearly 600 of them are ophthalmic. And many of them, the mean age to detect diagnosis, an accurate diagnosis takes nearly 7 years. Each of this family running pillar to post without a label for their child's condition. When you don't have a diagnosis, you don't have a investigation, so is you don't have a treatment. And nearly 95% of them have no definitive cure. These are all life-limiting conditions. Some of them are vision-limiting conditions, and nearly 2/3 of them are directly involved ophthalmic rare conditions, and the rest 1/3 they're basically consequences to systemic diseases. We have the battery of investigation to pick up, make a diagnosis. One of the key messages I want to give you here is that in isolation, as a pediatrician alone, as an ophthalmologist alone, we would not be able to make a diagnosis. In a single umbrella, if all of us come together, including a neurologist, geneticist, genetic counselor, we would be able to give them diagnosis, be able to diagnose them and prognosticate them and give a roadmap through the genetic counseling and genetic analysis. So the early diagnosis, early referral, genetic insight which give a detailed roadmap, and integrated care perhaps actually give a quality to many of these children. This is one of the storage condition. Can we run this video? And this child, before the corneal transplantation, he was confined to room. Even his elder sibling was not liking him because he looked dwarf, he looked quite abnormal. Can we keep a sound, please? If you look at following a transplantation, despite his joint deformities.
Oh, it's really good.
Sitting also.
We have to laugh for you.
Mother was saying, he practiced this one, wanted to show me, even in the school. Even in his elder sibling who never used to like him, he became He's a 9-year-old boy. And most of the storage disorders are intellectual disability. Half of his optic nerve is damaged, all joints are in contraction. He has a epitomegaly, splenomegaly. He can't even close his mouth if you see. He has such a protruding large tongue. Entire nasopharynx, oropharynx is completely obstructed. Even if he survives 40 years, 30 years, we are actually adding the quality, right? Quality of the life. So at LV Prasad, we are privileged to Can we run this video, please?
When she was born in May 2021, her parents noticed that her eyes looked different.
Her eyes are blue. I remember the first question I was asking, like, does she have any eyes? What's her problem?
Over the next days and weeks, they searched for answers. Doctors told them it was a serious problem with the cornea, the clear front part of the eye that focuses light.
We were told many doctors this is explanation.
The doctors in Yemen, they told us that there is a well-known institute in India, which is LV Prasad, and they referred us to India. We met Dr. Muralidhar, who was like, for me, he was a gift from God.
At around 3 months of age, she was examined at LV Prasad Eye Institute in Hyderabad, India.
This child in question presented with a bilateral sclerocornea. Right eye was much more severely involved than left eye. Hence, right eye we could not offer any surgical intervention.
Sclerocornea is a rare condition where the clear cornea becomes opaque and blends with the white part of the eye. It can severely limit vision from birth and is often difficult to treat surgically.
The doctor explained the problem, and he told us that it's better for us to wait when she's like 4 or 6 months to do the surgery for the left eye, but he told us that the right eye, because there is no hole in it because of the optic nerve, which is not functioning, it's better not to do any surgery. And in the future, if she has another problem, then he will put an artificial eye. She's very young, and he's always told us that the hope is only in one eye.
Working closely with the family, the team at LBPEI developed a plan for the left eye, but there was still a possibility of useful vision.
Left eye, after a careful investigations, we were able to delineate all structures in eye, including iris, pupil, lens, retina, and the child was able to appreciate, light. So hence, we made a decision to, go for a penetrating keratoplasty. What we did is, we repurposed. Along with the cornea, we also included a donor corneal epithelial limbus. So along with this surgery, we also, used a specialized contact lens, stitching the eyelids, a part of it. That helps in healing, minimizing the complications. Post-operatively also we put child under both topical and systemic immunomodulators after obtaining a pediatric clearance.
In simple terms, the surgeons transplanted a clear cornea from a donor and at the same time transplanted stem cells from the donor's limbal area. These stem cells help the surface of the eye stay clear and stable over time.
So traditionally when we do keratoplasty in such eyes with a sclerocornea, they don't do well. The reason behind, they do not have stem cells. It helps renewing the skin-like layer on the cornea. Secondly, they have a fluid blood vessels that results in immune sensitization and end up having a irreversible rejection, end up having a graft failure. By doing the specialized approach along with immunosuppression, we have seen experience or results. The graft survival has jumped to 84% up to 5 years. Meaning, our goal is, taken care. If we are able to maintain, in a majority of the cases, graft clear for the first 5 years, as a surgeon, as a parents, we have achieved our target by stimulating the child's brain.
The next visit for us to India, we did the regular checkup. So her eye, he said this is the right time, and the success rates are higher, so it's better to do the surgery now.
Now, at 3 years of age, the surgery was scheduled.
This was 30th of July, the next day, when he removed the patches, and she was able to see. The first thing was the fingers of the doctor who used to wait for her, and she was able to detect that these are his fingers, and she touched them.
That simple moment, recognizing her hand, reaching out to touch it, marked a turning point for the family.
she was able to recognize better things. I mean, I felt the happiness, though she didn't say, but I felt she was happy to recognize so many things. Before, I used to see that she can see, but now, after the surgery, no, now she can see.
Even a failed corneal graft have a much better transparency than actual sclerocornea.
In early childhood, the brain is especially adaptable. Meaningful visual experience during these years can help children build visual pathways that support better functioning later in life, even if the eye needs further treatment.
He bring the life to my daughter.
Behind every corneal transplant is a donor and a family who chose to pass on the gift of sight.
Long years until an intervention. They are from a war-broken country. They have to come and stay here 3 months to get a child enabled to see again. And at the end, if you can see that there is no difference between an elder sibling who is normally sighted and the child who received a transplantation. Thank you.